Hey guys, this is going to be a review on my M3 medic bag. I bought this bag at a surplus store for around $30. It contained emergency food for about 3 days, but I took all that stuff out and stuffed it with medical items. I designed the bag to treat a patient with a mechanism of injury being that they fell off a bike. I ride group bike rides at night, and usually almost always, someone always ends up on the floor. Some of the items in this bag are there because I also carry this bag around me when I can. It's a low profile bag and people don't suspect it as any other purpose other than to hold my personal items. For me, this is a great thing since I'm walking around in public. I'm not able to carry any airway in this bag because of its size. Its purpose is to control bleeding, splint, and bandaging, and wound care. Since I most likely won't be dealing with any danger of losing a patient's airway and breathing, unless they hit their head pretty hard and damage their brainstem and causes them to become apneic or something like that. Of course, you should always assess your ABCs on the patient, especially if unconscious. Any threat to the patient's airway, breathing, or circulation, emergency medical services should be called. Going back to the bag. When this bag is around my chest, hanging just to my waist, as soon as I unbuckle it, it will open up, giving me access to 3 compartments. An instant access. First, I'll talk about the outside. Around my waist, this is a 511 glove pouch because BSI should be your number one. Not only to protect yourself from any diseases that the patient might have, but also to protect the patient from anything you might have on your hands. Always wear gloves touching a patient. On the back, I got a Phoenix light. It's 1000 lumens. It's good for letting people know you're there or to spot something in the dark. I also love it because of its size. It's a tactical light. In the back, I got a headlamp. It's just a cheap $5 headlamp back there. It's strapped with being held down by some molly gear or something like that. Moving to the bag. Looks like a regular bag unless you kind of look inside through the side. Opening the bag on my waist, this thing will open up, giving me access to 3 compartments, but since I'm opening on a flat surface now, I manually have to open it. And my first compartment is bleeding, the second one is bandaging, and third one is wound care. The instant access I was talking to was the shears and 2 30 cc's of sterile saline for wound or eye emergency irrigation, a mini mag light to assess pupils for pupils equal and reactive to light, which is pearl, tissue forceps to remove debris from a wound if needed, and my bandage scissors back here. And these smaller scissors to trim the edges off any adhesives that are starting to peel off. It's just like really pointy scissors. The bigger the flap gets on the adhesive flap that's on the bandage, say a Tegarin film, the faster it'll fall off. So trimming it gets really important. These are just 30 cc's of sterile saline. Back there I have 2 biohazard bags. Somebody got this stuff out there. 2 biohazard bags, I won't take those out. Just some benzoyl wipes, wet ones. I have four packs of 4 of sterile saline. These are 5 cc's. So in case someone gets something little in their eye, I don't have to open up the 30 cc's of sterile saline, saving me these since these are actually pretty expensive and hard to get. I get these on about 100 pack. So usually there's bugs at night near the riverbed, so these are really good for washing out your eyes. So the first compartment I'll talk about will be the wound care, since it's packed the most. On the wound care, opening it up, there's a 2x6 sterile water gel dressing. I love this because it seems to have enough gel. It seems to have like about a quarter of water gel that a bottle would have. So it's like almost like carrying a bottle but in a flat package. And also because it's infused gauze. I have 2 more 30 cc's of sterile saline. That's over 100 cc's of sterile saline for emergency eye wash. Silver sorb. It's just hydrogel with silver in it. Use these for scrapes and stuff. It heals them up pretty good, pretty fast. Just some ear protection for me. Here's 100 cc's of sterile saline. This is for irrigation of large wounds. I have a blunt needle somewhere in there in my wound care bag. And I would mix povidone iodine with this and use a 60 cc syringe and pressure wash that wound to get any bacterias and flush out any debris that could be left. And here's just alcohol prep pads. A sterile lancet for splinters. A flat lancet is better than a needle for taking out splinters. These are sterile Q-tips, not sterile, sorry, individual Q-tips, just for minor first aid or applying ointments and stuff like that. And these are just povidone iodine swab sticks. You break it and it fills up. And these are swab sticks with saline in it. You break it and these are individual. You just break it and it moistens up with saline. It's for a dry nose. People who have those problems or allergies. Moving on, I have a transport medical tape. This stuff is amazing because it stretches with your skin. It sticks on really well. So after about like a day, and if you're a hairy person, this thing will hurt like hell to take off. Unless you have I don't know how to pronounce this correctly, detachable. It's an adhesive remover, like almost like mineral spirits. But supposedly it's for skin, made for skin. It doesn't sting on cuts. It's a really good way to remove adhesives. Also, so it won't give you a waxing taking this off. A small Vaseline bottle for cuts if I don't want to use it. Silver sword stuff or chap lips. Next Care foam tape. This is basically moleskin, waterproof moleskin. This stuff works really well. I've bathed in it and it does not fall off. I love Next Care products. And here's basically my mini medicine kit. There's rehydration salts. I'll just pull everything out for you. Rehydration salts, you combine this with a liter of water. 2 emergency packets back here. I usually drink these when I'm feeling sick. Some lotion. You never know when you get ashy. You need some lotion. Something like that. More lotion. Oh, benzocaine. It's aura gel basically. It's for toothaches. But I have it in there to put on the skin. Leave it on there for a couple minutes and before I take out a splinter, so it can help with the pain. Motion sickness stuff is really expensive, but it works. It works for me. Some Halls. a pain patch, just one in there. In the back I got 2 burn gel packets, acetaminophen and ibuprofen tablets, and my triple antibiotic ointment packets in here. I got multiple packets in there. I would hardly use these. I usually use the silver sword gel, since I like going towards more of a natural. I know silver sword's not natural, but to me it seems like a better choice than that. And these are my bandages. I don't really carry any fabric or plastic bandages in this bag because they suck. You wash your hands, they fall off, they get soiled, you have to take them off. You keep exchanging. It's cheaper to just invest in next care bandages. These things are waterproof and more flexible than any bandage you'll ever see. I have sizes in here from small to medium to large to XL. And these are my large knee bandages. These work amazing. They stay on when you shower. They stay on for 7 days, basically. And back here are just my regular Tegaderm films. I'd use these for, in case I know there's not going to be any drainage from a wound. It's just a small scrape, I'll just put that on there. And back there I got some Flexaid Band-Aid by Johnson & Johnson. It has a hydrocolloid gauze in the center. What that does is it makes it a moist environment for your cuts to heal faster. But I haven't tested those out myself, but I know NextCare works really well. This is my bandage. This is a bandage bag. So moving on is my wound closure bag. I'm not gonna pull everything out in here, but I have a Chloroprep applicator. Those stitches, those little band-aid stitches. Forgot steri strips. No, steri strips are actually in the back. Butterfly stitches. That povidone iodine to mix with that sterile saline, a 3cc syringe, and that blunt needle I was talking about there. Sorry you can't see the tip, but you're just gonna have to trust me on it. It's blunt. Large Tegaderm film in the back on the face mask. A drape to try to keep your field as sterile, not as sterile, as clean as possible. Some sterile gloves, which I don't really need to be sterile, but I didn't want to fold up my own gloves and throw it in there since these were already folded. I don't even know if they fit me. Oh, I got more gloves in there. And benzoin tincture. I believe it's benzoin. This stuff works really well. It's an ampule, and you place it on around the wound. Not only does it protect from bacteria, but it makes your films or any adhesives that you're going to apply adhere really well. It'll wax you, basically. That's how hard it sticks. And these are my fabric bandages. I hardly have any in there. I just have like one of each. Small, medium, and fingertip bandages, knuckles, and my knee bandage, of course, right there in the back. A benzoyl spray. This stuff sucks. I don't really see the use of it. It's overpriced Neosporin. It's overpriced benzoyl. Oh, it has a pain reliever. Yeah, I think it's benzoin in there, something like that. Space blanket. I'm pretty sure I won't ever encounter someone going into shock or anything like that. But it's good to have in there. And this is my small hemostatics. There's blood stoppers in the back. There's 1x1s, and there's only one 2x2. These work alright, I guess. They're not all that. I trust the wound seal better since that forms an instant scab over bleeding. You need blood for that to work. For both of these. These are pretty pricey. I wouldn't pay them. I wouldn't buy that blood stopper, but I'd get that wound seal. And back here's non-sterile brushes. I have these because I have an E-Skin bottle here, And this bottle comes with one brush, and I was like, won't that contaminate the whole bottle if you put it on a cut so it's bleeding? So I just got these brushes to help try to keep this bottle clean. Plastic tissue forceps, cheapo kind, disposable. And these are my knee bandages. These are really large. They're the kid ones. I don't care though. They work. They gotta serve their purpose. And that's all I have in the wound care compartment. Moving on to the bandaging compartment. I'm gonna move a little bit faster since this video is taking longer than usual. There's a 6-inch glow stick in there. Some hot hands in the back. Two Manuka Honey 3x8 inch, I believe. Yeah, 3x8 inch pads for road rash or something like that. A 1-inch gauze roll to hold sand finger splints in place, which I haven't received yet. A 4-inch ace wrap. A 4-inch cling roll. Another 4-inch cling roll. A cold pack. And these right here are just a bunch of 2x2s that I use for cleaning wounds. Some more 2x2s, and these are the 3x3s and 4x4s back here. I don't want to take everything out since it's like really compressed and it'll take a long time. So you guys are just gonna have to trust me on that they're in there. And there's also non-stick pads back there for in case I know that the gauze is gonna stick to the wound and removing it's gonna hurt. There's I forgot the others, just large non-stick pads. 5x9 ABD pads. There's 5 of these back there for soaking up blood in case I need extra gauze. And there's Clorox wipes right there to help disinfect anything that may have gotten contaminated. And that's everything that is in this bag, in this compartment. Everything is accessible straight from my hip. Moving on to the main compartment, which is bleeding. On the handle there's a flashlight there to look for stuff at night. First thing that's accessible, it's popping out at you, is a SOF tourniquet, I believe that's what it's called. It's a 1.5 inch wide strap. Sports tape for holding together that SAM splint back there, which is right there. And this plastic is a face shield that's connected to a face mask. For it's to use with the sterile 60cc syringe. When I'm pressure washing a wound, that splashback won't get in my eyes. These are sterile tongue depressors. I have them there for these triangular bandages. So either if I have to make a tourniquet, I can make that windlass thing and twist it. I have a 25-gram quick clot sponge for arterial bleed, for small arterial bleeds, I guess. And I don't even know if there really is a small arterial bleed, but those bleeds. Let's say you fall on your temple. There's a story someone fell on their temple and that blood's squirting out, and some dude took out his sweaty ass shirt on the bike ride and put it on his cut. And so yeah, I wouldn't want somebody to put their sweaty ass shirt on me. And if this fails, I have a combat gauze back there to back it up. I have a 6-inch ace bandage right there. I want to pull it out. This stuff is really hard to pull out. I mean, it's really easy to pull out, but hard stuff back inside, and I haven't took a long time to organize. This is a 6-inch roll. It's pretty jacked up, but it uses to practice. This is the wound irrigation. It's hurt free. It's benzoyl with lidocaine in it, so antiseptic. There's 2 blood stoppers back there. This is a blood stopper. It's basically a 5x9 with 2 clean rolls. The clean rolls are these. One of them's attached to the 5x9 and the other one's loose for an extra one. These will not rip on you if you're using it as a pressure dressing. Personally, I wouldn't use this as a pressure dressing. I'd use the Ace wrap, since the Ace wrap's a lot easier to add pressure to. Back here I have 2 H&H compressed gauze. H&H compressed gauze is basically a Kerlix roll that's compressed into this. So compared to the size, I was barely able to fit one of these before in there. Thanks to this, I would have fit 2 of them in there. I have pressurized sterile saline wound wash. Here's an empty one to irrigate deep wounds really quick before I bandage it up, try to clean it up. That is everything that I have in this compartment. Looking down from my hip, this is what I would see. So everything is accessible with just one hand to pull out. If I have to get a 25 gram quick clot, my tourniquet, it's gonna be here. Everything is accessible except that sand splint, but that sand splint I should always have time to splint a bone, since it's not any life threatening. Everything that I need is right there for bleeding control. To close up, I hope I gave people ideas on what to put in their bag, or how to set up their bag, or if they think they like this bag and they should get it. I'd recommend this bag for anybody that wants a bag to carry around with them that looks low in profile. Nobody knows that it's a medical bag. People think it's my personal bag. That's what I love about this bag. I just can't find a place where to put gloves in there, so I get this 511 glove pouch. It seems really durable so far. The elastic hasn't lost its elax, whatever that word is. I'm able to fit around 7 pairs of nitrile gloves in there. Those are 6 mil too, so they're pretty thick. And if you guys want to see a video on my home kit or travel bag, post down in the comments. This bag does airway, breathing, circulation. Does a lot of stuff. I can't name it all from the top of my head.